minutes before the team ultimately fell short. PSG will meet either
Good morning.
Welcome to the morning show.
Yeah.
The Big Show with Glenn and Angel on Kiss 92.
Good morning.
Sometimes getting out of bed in the morning is a lot to deal with all at once.
Good morning, Singapore, and welcome to Good Morning Doctor. And we welcome back to the studio our favorite dermatologist from Parkway Medicentre, Dr Joseph Toh. Good morning, Dr Toh.
Good morning.
Good morning. Welcome back. It's good to see you again.
Good to see you guys.
I told all of you, right, he looks like K-pop superstar.
He's
for the
been
people who
talking
are
about
watching,
it all morning.
Watching for the first time. There you go.
Okay, so today, very important topic because it's all about our skin. Well, obviously, because you're a dermatologist, but it's the fight between light and dark. So we're talking about two different sort of pigmentation problems. Can I call them that?
Yes.
Pigmentation. So there's vitiligo? Vitiligo and melasma.
Melasma.
So tell us the difference between
Well,
the two.
the fight between light and dark.
Dark, yeah.
Darkness. Sounds like Star Wars.
It does, doesn't it?
So, vitiligo is a condition that causes the skin to lose its pigment or color, whereas melasma is a condition whereby the skin produces too much color, and that usually affects the face, sometimes the forehead, the chin, the cheeks, and rarely the neck and the forearms. Vitiligo is actually a condition that is thought to be immune mediated, so it's somewhat of a immune system problem where your skin has decided to attack its melanocytes, which are cells that is in the skin that produces melanin, which is what gives us our color. So in a fair-skinned patient, you have less melanin, but in a dark-skinned individual, you have more melanin. But in a patient with vitiligo, you lose the ability to produce the right amount of melanin, and therefore you start to develop pale, pink or even white patches on your skin. Vitiligo, in comparison to melasma, vitiligo can affect any part of the body. But for example, it can affect the hands, the feet, skin near the body openings. For example, your eyes, your nose, your mouth, your belly button, and also in the flexural areas of your skin, such as in front of your elbows, on your elbows, behind your knees, in your knee, on your knees, as well as on the groins. Yeah.
So can I ask you this question, Doctor? Because growing up, I used to play a lot of football.
Yep.
Be out under the sun, very often. And my mom used to tell me, when I come home, like straight after coming out of the sun, right? Rest for a while, cool off. Don't just go to the shower and shower down with cold water. If not, you get vitiligo. Is this true?
Vitiligo is not going to be affected by the way you shower. But I think that the older folks will always want you to not go into the shower immediately because they worry about
white spots.
White spots. Also, it's different.
Yes, totally different.
I thought vitiligo is also the white spots. In Malay, they call it panau.
Yeah, no, it's completely different. That one is curable, right?
So that
white
is
spots.
actually a fungal infection called tinea vesicolor. So that causes you to develop white patchy areas where you tend to sweat. which is
Okay.
usually on the chest, the upper back, and the shoulders. And army boys usually get it because
Right.
they're sweating so much under the sun,
Okay.
wearing the army uniform.
I see.
Vitiligo is completely different.
Okay.
Vitiligo is associated with Michael Jackson.
It is though. It is because from what I've read online, he started wearing his glove because he was covering up the fact that his hand was going white. And that was the start of vitiligo for him. And then we were chatting before we went on air, and Dr. Joseph, you were saying that he probably went for bleaching. Tell us a little bit more about that. Is that the only solution to someone who has vitiligo, or can it be treated or reversed?
So vitiligo patients can actually regain their pigment, usually through treatment, but sometimes you do also regain the pigment without treatment. But of course, that is not so common. Okay. And even after treatment and you regain your pigment, that doesn't guarantee that the pigment stays on. So vitiligo can recur throughout your life.
Oh, wow.
So vitiligo is especially easily triggered upon skin pressure and friction. So if you have a cut or if you scratch your skin too much, the areas that have the injury can develop vitiligo on those areas. Vitiligo is not curable, but it can be treated with a variety of options, which includes things like cream, phototherapy. Sometimes we do surgical grafting, but in cases where the vitiligo is too extreme, where there is just too large surface areas to address, and some options do want to try an option of bleaching normal skin, although that is not very common because severe vitiligo is still not super common.
Okay. Let's continue to talk to Dr. Joseph Toh, dermatologist from Parkway Medicentre on the Big Show TV. Meantime, here's Red Velvet with Cosmic on Kiss 92.
Is that the reason more people with vitiligo would opt to remove the melanin rather than treat it because there's a chance it might come back?
I think the option of removing melanin from normal skin is not common.
Oh, it's not. It's not common.
So most patients have vitiligo because their vitiligo is patchy, meaning they affect irregular parts of the skin and it's small amounts, so it look uneven.
Yeah.
So most of the patients still try to address the problem areas, especially darker skin individuals who in which vitiligo is very obvious.
We have Kelly that's asking about a certain cream. It's called Obzelura that's available in the US that helps with vitiligo. Wondering if it's available here in Singapore.
Obzelura is a new cream. It's a novel cream that is I think approved in the US, FDA approved I think 2 years ago to treat vitiligo. It is a cream that contains a medicine called ruxolitinib, which is actually a compound that we use to treat blood disorders.
Okay.
But in the topical form, it is found to have some impact on vitiligo and is therefore approved in the US. It is available in Singapore for prescription on a named patient basis. So we bring it specially if a patient needs it.
Oh, right. So it's not just, you don't stock it in your offices. If you need it, you bring it in.
I would say it's not standard and not readily available, but it's a named patient basis.
Okay. So they can get it if they want. Yeah.
What are some of the ways? I mean, what causes? I know you kind of mentioned it just now on air, but what causes vitiligo?
So vitiligo is not the reason why people get vitiligo is not often well understood. I mean, even after all these years of research, but we know that it is somewhat of a genetic problem. You may have family members who also have vitiligo, but it's not always necessarily the case. It is a process whereby your immune system shuts down your melanocytes, so you don't produce melanin, and therefore you lose color. Some patients with vitiligo have issues with other immune system problems like thyroid problems or conditions like lupus. So sometimes when we see vitiligo patients, we do a blood test to make sure they don't have thyroid as well.
Do they often come together? Or
they can come together.
They can come together. Okay.
Yeah. And all those conditions are what? Stress related?
As with most autoimmune problems, it's often blamed to stress.
Wow. Okay.
But I mean, it is really random, and different patients with vitiligo have different severity of vitiligo, and the progress of the vitiligo can be very variable. So most patients with vitiligo have very stable disease, meaning their white patches remain stable over the years with very, very slow change. But there are patients with very aggressive vitiligo that is unstable and rapidly progressive. So when we see patients, we always want to make sure that we stabilize their vitiligo, meaning stop the spread, and also subsequently discuss options to repigment.
Right.
Okay.
So let's stop stressing each other out.
Okay, let's it's not going to give us vitiligo.
Very
okay?
competitive as well.
So let's go to the opposite end of this light and dark, and let's talk about melasma. And I think melasma is a more common occurrence than vitiligo. It is not an autoimmune problem, right? Tell us what it is and what causes it.
So melasma is actually a condition that preferably affects ladies. 90% of melasma cases are actually female.
Oh, wow.
10% is male, so it's not exclusively female problem. Melasma is usually brought upon via too much exposure to UV. So meaning ultraviolet exposure. Sun exposure aggravates melasma, but there's a hormonal component to it. So if you are a patient who is on some sort of hormonal therapy, for example, birth control pills, or if you are undergoing pregnancy, or maybe if you are going some sort of hormonal treatment for menopause.
Is that what they call the pregnancy mask?
Correct. Melasma is also known as pregnancy mask.
Pregnancy mask. Because some women who get pregnant, they will get this whole sort of darkness on the skin.
Like grayish?
Grayish, dark, yeah. And
So
it does go away.
So it looks grayish, greenish, black,
I've
brown.
seen.
Yeah.
So I would say about 25 to 30% of pregnant ladies get some form of melasma, but after their pregnancy, sometimes it fades off, but it can recur with the second pregnancy.
Okay. And so, clearly I'm not pregnant, and this is not a pregnancy mask, but I have melasma. I've also read online that it could be a menopausal thing as well for women who hit menopause.
So hormonal changes can cause melasma.
Okay.
Hormonal medications can cause melasma or worsen melasma.
I think my key question is there a cure? How do we get rid of it?
So melasma can be treated. So usually we go stepwise. So obviously the most conservative method always comes first. So there's an option of using topicals. So topicals can come in the form of lightening creams that can help lighten the skin slowly. This often contain active ingredients such as hydroquinone. Sometimes we also use a cream that contains retinoids, which is traditionally used to treat acne, but it can help to reduce the pigmentation in patients with melasma. Subsequently, there's also alternative methods such as taking oral medications. There's a tablet called tranexamic acid, which is traditionally used to stop or reduce bleeding. But when you take it at a certain dose, it can help to lighten melasma. Because melasma has a sort of what we call vascular component, which too much or abnormal blood vessels aggravate the deposits of pigment.
Wow, okay. So there is help out there for either one. Yeah, but
I wouldn't have known actually.
Yeah, no, because I take a lot of effort to cover it up because it is a self-confidence thing.
I've seen you without your makeup.
No, you've never seen me without makeup.
I thought I have.
But I think my question is, I mean, it affects my lifestyle.
Of course.
Because I like being out in the sun. I like going to the beach. I like watching the sunset. But now I'm watching the sunset with my head to the sun. Because the more sun exposure I get, the darker my skin gets, no matter how much sun cream I put on. So I guess
she says that she wasn't like that before.
No, I wasn't. Like, I think it started maybe 10 years ago or something.
Why is that so, doctor?
Melasma can affect anyone, but around a certain age where hormones change a little bit more, it can get aggravated.
For certain people, not everyone, right?
Yeah, so we do have younger patients with melasma. Usually, sometimes they are taking some sort of birth control pills. But it can also affect men and also across all ages, but usually after 20.
Usually after 20, okay.
Sunblock.
No, I use sunblock. Oh my gosh, I'm a sunblock. I'm
That's
a
a must.
sunblock umbrella. Yeah, no, I just got this thing I was telling Glenn about, which he might be able to use on.
She wants me to use it. I mean, it's nice of her
It's a
to
sunstick?
always remind me to.
No, not
to wear.
chapstick. Even it's
it's a
Film.
a gel patch film. It's like
okay.
almost like a peel off mask. So
Okay.
it's see through.
Great.
And it's UVF.
Opaque. UP opaque.
UPF.
UPF or something like that. Yeah.
Some sort of a UP opaque kind of
Opaque.
a covering, right?
Yeah.
But
Sounds
it's
good.
clear.
Sounds good.
Yeah, so I'm going to try that, test it out, go out in the sun. I need a beach holiday for this, clearly. So I need to take some leave.
Man, if that works on the golf course.
Oh my gosh.
No, but then
It'll
maybe
be
when I
life-changing
perspire,
for
it
me.
will come out.
I'll test it for you. Don't worry. I'll do all the tests.
Oh, okay. All right. Going back on air.
Kiss 92 traffic.
On the BKE towards Woodlands, right before the KJE exit, avoid lane 1. An accident has been spotted. Also, another accident, vehicles broken down on the BKE towards Woodlands as well. This is causing quite a bit of backup to the Bukit Panjang Road exit. Avoid lane 3. So both lanes 1 and lane 3 on that stretch are affected. One with a broken down vehicle, one with an accident. Let us know if you spot anything. 885550
Welcome back to The Big Show and The Big Show TV. Our guest for this morning is Dr. Joseph Toh, dermatologist from Parkway Medicentre, and he's on the show for the second time. Always nice to have you on the show, Dr. Toh.
Thank you.
Today we're talking about vitiligo and melasma. Now, I do believe that earlier on, I mean, you were telling us about what vitiligo is and what melasma is, but the question I want to ask you right now is, for someone who's listening in and is not sure if they have vitiligo, what are some of the signs?
So, vitiligo is usually not symptomatic. So, patients don't usually have any form of symptom other than the fact that it is not even color.
Okay.
But sometimes when the vitiligo is starting to appear, you can feel a little bit itchy, but that's not common. So, most of the patients with vitiligo, they are completely asymptomatic. So, no pain, no itch. It's just an uneven patch, which is unsightly or not desirable in patients. Therefore, they seek help.
And it's very clear that it's vitiligo because it's not like a white spot. It is complete removal of the melanin.
So vitiligo can come in terms of most common, it will be completely white, but it can be pale or light pink depending on at what stage.
And does it get bigger?
It can. So vitiligo often is very stable or slowly change, but it can change. So it can get bigger. Therefore, when it will affect a large area of the skin, but can be uneven, so it can be small parts of the skin as well.
So what do you do if you're unsure? Go and look for Dr. Joseph Toh,
Yes.
at Parkway Medicentre.
As much as we're talking about vitiligo, which is a very important topic, we have a lot of questions about melasma because I feel a lot of women might be experiencing it themselves.
All right, ask Dr. Joseph Toh now.
So Hui Yi has said, I have a friend who said her melasma got better with V-beam laser. Does it really help? Now, earlier when you came into the studio, we were talking about pigment laser treatments and stuff like that, and you had kind of like a public service announcement to make in terms of removing age spots and removing melasma is not the same thing.
Yeah, so say age spots and sunspots, they are very responsive to things like pigment laser, which are lasers that used to attack excessive melanin. But melasma is somewhat of a hybrid condition, so it is somewhat hormonal, somewhat UV exposure, somewhat vascular in a way. So if you are a person with melasma and if you happen to undergo a pigment laser that is of a not so ideal setting, it can cause the melasma to get darker. So melasma, as I was telling you, Angel, is not a forgiving condition. So if you do not use the right energy levels, you can get darker. So just back to the question about the V-beam. So the V-beam is actually a type of laser that's actually a pulse dye laser. So it's actually a laser that's designed for patients with red birthmarks, those babies with birthmarks on their face or on their body who wants to get rid of them. So it attacks or reduces the red blood vessels. But when you use it for patients with melasma, it can potentially help the melasma because melasma has what we call a vascular component because too much of abnormal blood vessels can aggravate melasma. So the pulse dye laser is a more gentle way of addressing the progression of melasma.
Okay, all right.
Okay, let's continue to talk to Dr. Joseph Toh on The Big Show TV. Meantime, here's Maroon 5 featuring SZA, What Lovers Do on Kiss 92.
Yeah, so we excuse me, we have questions about the Pico laser as well.
Pico laser?
Yeah, Pico Way laser. Robbie is asking as well as Angela. They have said, tried Pico Way laser, does help my pigmentations. Can it help improve melasma as well?
Pico second lasers are a type of pigment lasers. So it serves the purpose of attacking or addressing excessive melanin. So yes, it can help patients with melasma, but as I mentioned, you need to use it at the right energy levels.
So the frequency needs to be correct.
The frequency, the wavelength, as well as the energy levels has to be tweaked in a way that is suitable for melasma. So Pico Way, I think it's something that we can use for patients with melasma, but probably we have to do it in a lower energy level, so in a toning method, rather than an aggressive method that you use to zap age spots.
So the same machine can be used for two things. It's just a matter of different wavelengths and frequency. Right. Okay. So just make sure you have a good dermatologist that knows what they're doing in terms of the frequency, because your melasma can get worse if they have it at the frequency for age spots and sunspots.
Doctor, I got something that's bugging me.
Yeah.
If you have a look over here, there's like a little bit of a dark.
Correct. Yeah.
What is that?
It looks like what we call solar litigo, which is a sunspot.
Oh,
so
okay.
I've got the same as well, yeah.
Pro golfer, too much sun exposure.
Oh, no.
You need to cover up.
Okay, so how do I get rid of that?
Oh, well, you can, of course, try lightening creams first and see whether that helps.
Okay.
Or if not, we can always do a procedure or such like a energy level device like a laser to get rid of it.
Is it easy to get rid of?
You can.
How many, like for him, if you're just looking at how many sessions would he require for something like that? 3?
2 to 3.
Really?
Yeah.
Oh, okay.
Yeah.
But
Sounds not
if
too
you
bad.
are someone who goes under the sun a lot, then you might have to adjust your expectations.
Extra sunblock over here then, because now I think I'm just putting a thin layer.
And he only puts it once at the start of the day. He doesn't. You don't top up.
Sometimes before my golf game, I'll And what about those pills? Do they actually work?
The pills for
Sunblock pills.
sunblock. I think we talked about it the last time. They will not be able to replace topical sunscreen. Unfortunately, it's a good additional protection, but topical sunscreen is still superior, and you need to reapply it at least every 3 to 4 hours.
Okay. Just to remind you guys, because some people think, it's like you just take those pills, you don't have to apply
anything else.
Sunblock.
Yeah, for sure. No,
no.
So, okay, I want to talk about UV exposure and being in the office as well. How much light exposure in the office and from our computers will affect our skin?
I think there's no proven link between personal devices and the blue light that is related to melasma. Although we know that visible light and ultraviolet light from the sun can cause melasma, but I think that the blue light that comes from personal devices is not
safe.
Very well linked. Yeah.
And regular office lighting, home lighting?
I think that is not too much of a concern. I think the sun is more important.
Okay. All right.
Just back to the treatments you mentioned, like for the sunspot, right? Is there downtime?
Of course, pigment lasers are not lasers that causes the color to come down in a unilateral manner, meaning it doesn't come down straight away. So you do get the initial darkening before you lighten, darkening and lighten. So therefore you need repeated sessions.
I see.
Usually that's what we call the downtime, because that is where the dark spots gets a little bit darker and then it gradually scaps.
Right. Okay. But if he were to go for it today, would you recommend that he stay out of the sun
Most,
until?
yeah,
okay.
definitely.
No
After
golf
laser,
for you.
yeah. So after laser, you definitely need to sun protect because that is when the melanin is usually. I mean, the melanin deposits can be, very quick.
Active.
Yeah.
Yeah.
This is where I'm horrible at. I had
Yeah.
all my tags, as I mentioned just now to you, doctor, removed, right? And it was just uncomfortable. It was eventually like scabbing and all that. So I wasn't supposed to go out under the sun and play
And
golf
you
for like
did,
a whole
of
week.
course.
And of course, 2 days later, I was
Of course
out
you did.
on the course.
So, is there any way to prevent vitiligo and melasma?
Melasma definitely can be preventable because, just be very, very careful about UV exposure. That's number one.
But
Number
it's
two,
hormonal also.
Yeah, so if you are having, if you are a patient who some sort of have a need to start hormonal treatment, just have a conversation with a practitioner to see what are the pros and cons.
Okay. What about vitiligo?
Vitiligo, unfortunately, is very unpredictable. So you can't really prevent it for sure. But if you start noticing white patches, be mindful and then observe if it's unstable and it's progressing quick. The need to stabilize it is there. So we need to come and see a derm.
Okay. So just look around your body and see if there's anything extra that doesn't belong.
So, I'm just thinking like for the Caucasians.
Yeah.
The very fair Caucasians. If they have vitiligo, sometimes it's not
They
noticeable.
can't tell.
Right.
Yeah, which is a blessing.
Especially like your redheads and stuff like that because they're
can't
super,
tell.
super fair,
Yeah,
right?
you can't tell. But if the vitiligo is happening in a hair-bearing area, then the color of the hair may be lost as well.
So, but you won't lose your hair.
You
It's
won't
just
lose
the
your
skin,
hair
right?
because
Okay.
the hair is still intact. But sometimes when you do have active vitiligo in, for example, the scalp, you can have white patches. White hair growing out of that patch.
So that means the hair on your arms also,
Can
if you
turn
get, it
white.
will turn white as
Can
well,
turn
right?
white.
Okay, whichever area it is. Okay.
That's interesting.
It is. So, any tips that you can give us? The sun is even harsher today than it ever was.
Yes. Vitiligo patients, because of the lack of melanin, they are not protected against the sun, so they tend to get burnt easily. And burn, being an injury to the skin, can aggravate vitiligo and cause it to spread. So you really need to sun protect.
And cover up, like
Cover
they have sun protection clothes as well, right?
Yes, just cover up. as
Oh
much
my
as you
goodness.
can.
I'm thinking about my golf trips in Thailand.
Yeah.
Because it's really hot there.
But do you wear shorts and?
Yes.
Yeah.
Why?
Yeah, exactly.
Why?
Like it feels okay now, but once you hit a certain age, you're gonna regret doing that.
Because it's so hot, right? So I want,
Don't they have
to wear
cooling
less.
pants, like fan for your pants or something?
I think maybe I should start wearing longs.
I
Yes.
think so.
There's no choice, huh?
And UV protected longs as well.
And sleeves
So
as well.
everything, yeah.
Yeah. Okay, let's go back on air one last time.
Kiss 92 traffic.
On the PIE towards Changi Airport after Bedok North Avenue 3, a vehicle has broken down. Also on the TPE towards the PIE after the KPE exit, another vehicle has broken down. There is an accident on the BKE heading towards Woodlands before the KJE exit. Do avoid lanes 1 and 3. There's a bit of a mess there. If you spot anything else, 885550
Welcome back to Good Morning Doctor. Our doctor for this morning is Dr. Joseph Toh, dermatologist from Parkway Medicentre. I think this is the Woodley Parkway Medicentre that you're at, right, Dr. Toh?
Yeah.
All right, so if you need a dermatologist, make sure you go look for Dr. Toh, okay? Now, before we let you go, doctor, what are some tips that you can share with our listeners to take better care of their skin?
Okay, so number one is, as I kept emphasizing, I think number one is the sun protection part. So remember that the UV radiation from the sun is just not worth it. So always protect yourself with a good sunscreen, at least SPF 50 and above. If you are staying out of the sun for long periods of time, always consider getting some sort of a vitamin D replacement, because you're not going under sun, your vitamin D levels can drop. But vitamin D can be taken orally, so that's fine. So you can always consider some sort of vitamin D supplements.
Right.
And when you mention sun protection, you're not just talking about the face. You're
Yes.
talking about the whole body, right?
Correct. Anywhere that has exposure to the sun. So your hands, your forearms.
Yeah,
Okay.
that's while getting exposed to the sun. But what about afterwards? You know, like shower gels and moisturizers.
I always advise soap-free cleansers, and always moisturize your skin as much as you can. So at least 3 times a day: morning, after every shower, before sleep.
Okay. Last question from Roby Augustin on our Facebook. Are the V-beam and the Pico Way lasers available in your clinic, doctor?
Yes.
Yes. Okay. There you go. You can look Dr. Toh up at Woodley.
Yes.
Yes. Okay.
Parkway Medicentre.
Parkway Medicentre, Roby.
Well, thank you very much, Doctor, for
you.
joining us today.
Thank
Always a
you.
pleasure to have you in the studio.
Always a pleasure to come and see you guys.
Yes.
Hopefully, we get to talk to you again on
Sure.
the show.
Let's make that happen.
All right. Thank you so much. We've been speaking to Dr. Joseph Toh, dermatologist, our favorite dermatologist from Parkway Medicentre.
We've got you covered on good